Thank you, Sandeep ji. Thank you, पूरा हिंदी टीम को मेरा धन्यवाद.
Just एक मिनट सिर्फ डॉक्टर संदीप बहुत बहुत शुक्रिया धन्यवाद और जो लोग थे पूरे थ्रू आउट थे उनके लिए बहुत बहुत शुक्रिया बहुत बहुत धन्यवाद. Thanks for having me. It was my pleasure being here. Thank you. Over to Dr. Anjani.
Thank you, doctor. Thank you. Now it is the time for our English session. We'll start the meeting with a silent prayer. Once again, good evening and welcome everyone for today's session. Really, I'm appreciating your presence here because we are continuously conducting this webinar without any break. That is because of your participation and encouragement. Welcoming all of you to today's session. Today's our guest is Dr. Deepthi Krishnamooርthi. She's a MD homeopath and working as assistant professor in Veerabhadrashwar Homeopathic Medical College Hospital, Karnataka. And she's practicing for 13 years and clinical experience in treating various clinical conditions like thyroid and female disorder complaint, infertility specialist. And she has presented papers on various platforms in Karnataka Qualified Homeopathic Medical Doctors Association. So I'm welcoming Dr. Deepthi Krishnamooርthi. Dr. Deepthi Krishnamooርthi.
Hello.
Doctor.
Yes, my video. Yeah, the host has stopped my video.
Let me check, madam. I'll make you as a. Can you open now, please?
Hello. Good evening, ma'am. Good evening, everybody. I am Dr. Deepthi Krishnamooርthi. Shall we start the session?
Yes, yes.
Okay. So today's topic is dysmenorrhea, a case series. As we all know, dysmenorrhea is a very common problem nowadays. Dysmenorrhea, usually in young girls, it is quite common. And in my clinical experience, I've seen that people with dysmenorrhea, most of them are ending up in PCOD. So dysmenorrhea basically is painful menstruation, which is so troublesome that it will cause the patient to not to attend to her daily activities. It will be so disturbing. And there are two types of dysmenorrhea: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea is there is no pelvic pathology. That is, there is no tumor, there is no endometriosis, there is no adenomyosis, there is nothing. It is usually seen in adolescent girls who have just had their menarche had started having menses. That also may be due to less pain threshold and for them to get settled with the new life. So usually, and also when the main causes of primary dysmenorrhea is psychosomatic. That is, the girl is really worried, so much worried about the pain. She's worried about menses, and this is primary dysmenorrhea. Secondary dysmenorrhea is usually seen in Paris women, where there is pelvic pathology. There is some kind of tumor, cyst, or tubovarian mass, or any other pelvic inflammatory disease. So such kind of things. So this is and women with that usually primary dysmenorrhea is cured following marriage and vaginal delivery. But secondary dysmenorrhea starts usually after delivery due to any pelvic pathology. So this is about primary secondary dysmenorrhea. And most importantly, the most important causes, as I told you, in primary dysmenorrhea is psychosomatic disorders and also some role of prostaglandins. Prostaglandins are potent vasoconstrictors. They cause severe vasoconstriction and severe spasmodic pain due to irregular contractions of the uterus. Then secondary dysmenorrhea is mainly due to some kind of pelvic pathology, maybe that, as I told, pelvic inflammatory disease, or it may be due to adenomyosis, endometriosis, or ovarian cyst, or such kind of things. The main important things we have to remember here is dysmenorrhea is a very common problem. It is seen in everyday practice, as all of us know. And the main here today I am presenting two cases. One is of primary dysmenorrhea, one is of secondary dysmenorrhea. The one of the primary dysmenorrhea is a girl of 14 years. She had just had menarche 6 months back, and that is she started with dysmenorrhea, where she used to have severe pain. She used to stop going to school, and that is what all those things. She had severe thirstlessness, and she was hot, and she was always had weeping tendency and all such things. In the first case, after studying her case, we had given her pulsatilla. With pulsatilla, she improved profoundly. Her dysmenorrhea became better, and actually she required 2-3 remedies to cure her dysmenorrhea. First, we are given pulsatilla. She was better for 6 to 8 months. Again, she started presenting with new symptoms. Then we gave her veratrum album, and with veratrum album, again she was better with 6 to 8 months. Again, finally, we had to give her cocculus. With cocculus, she was completely better. She never had dysmenorrhea after that. And the second case is second case of secondary dysmenorrhea. Here, the dysmenorrhea was because of PID, repeated, or what do you call it as recurrent pelvic inflammatory disease. She had 2 children. She was 35. This is because of recurrent infection. She had secondary dysmenorrhea. And here also she had severe traveling sickness. She was not able to go by car without vomiting. And during menses, when there was pain, she used to faint because of pain. She had vomiting, nausea, and giddiness, and she used to literally faint. When she had period, she had pain, she used to faint. So considering everything else, we had given her cocculus. With cocculus, she improved profoundly. Here, we required only one remedy. With cocculus, she improved profoundly until today. She was treated almost 5-6 years back. Till today, she does not have dysmenorrhea. So this is what I wanted to discuss. And also I wanted to tell you the rubric. I wanted to discuss some of the rubrics of dysmenorrhea which we can consider. There is a direct rubric called genitalia female pain menses during, that is dysmenorrhea. That is a direct rubric. That is a very big rubric which has so many remedies, which has so many variations, like menses before, menses during, and there are other rubrics like pain, abdomen, chapter abdomen, pain, lower abdomen, menses during, or suprapubic region, menses during. And there are other, and in the rubric dysmenorrhea only, there is flow, a sub-rubric called flow. Flow, better by flow, more the flow, more the pain. These are the two main rubrics, because usually this is the modifying factor. Usually dysmenorrhea will be better by flow, or dysmenorrhea will increase with flow. So there are a few remedies, very characteristic remedies. Say for example, if I should discuss some of the remedies, the most important remedy, I'll discuss some 8 to 10 very important remedies. First of all is semicifuga. It's a very good remedy for dysmenorrhea. Usually the pain is more with the flow, and it is more of membranous dysmenorrhea. That is what it is. Secondary is more of secondary dysmenorrhea. Here, more the pain, more the flow, and patient is, and all the mental symptoms are more during menses. That is, she'll have anxiety, and or a sensation of dullness of mind, and she's always hysterical during menses, during pain. This is semicifuga. Next, if we want to discuss the opposite of this, more the flow, less the pain, that is lachesis. And lachesis is a very classic remedy, as we all know. Lachesis, in lachesis, it is like hot patient, left-sided remedy. We all know all the mental symptoms of lachesis, like jealousy, suspicion. She is very egoistic, loquacious because of what do you say? Unsatisfied sex, we can say. All these are the problems with lachesis. Here, menses, the pain is better by menses. Not only pain, her general condition, generally she is better by menses. As the menses appears 2-3 before menses, she is really sick. All Simicifiga is aggravated during menses, but lachesis is better during menses because the flow makes her much better with all the complaints, like totally, even pain, the sadness, or her mind, everything becomes better. Generally, she's better with discharge, especially menses. So this is about lachesis. Next, if you want to, I'm discussing some keynotes. We all know the remedy picture. I'm discussing the keynotes. So if you want to take one more is MACPHOS. MACPHOS is a very good remedy for dysmenorrhea, where it is better by double binding, like colocynth. But colocynth, it is more neuralgic. MACPHOS is more spasmodic. MACPHOS is the on end of pain. Colocynth, there is more of like chamomilla. Colocynth has irritability. This is about colocynth. Again, chamomilla, irritable, severe irritability, and pain threshold is too low that even a very small amount of pain can disturb her. She may end up shouting. She'll become very angry, very cranky during periods, during pain. That is chamomilla. If we go to erigeron is also a very good remedy for dysmenorrhea. Erigeron canadense. Here, the dysmenorrhea is accompanied by dysuria and diarrhea. This is a very characteristic symptom. There's painful menstruation along with painful urination and diarrhea. Loose stools. This is a very characteristic of erigeron canadense. If we should discuss other remedies like Apis mellifica. Apis mellifica, again, the patient is hot, thirstless, and it is mostly right-sided, and there is soreness and stinging pain in the ovarian region during menses. The pain is sore and stinging kind of pain in Apis mellifica. And if you think of Bovista, again, there is pain with the flow in Bovista. And Bovista, the characteristic of Bovista is that the flow is either only during the day or only during the night. If that is during the day, there will not be a flow during the night. If there is flow during the night, there will not be flow during the day. This is the... Hello? Am I audible?
Yes, audible.
Okay. Next is bryonia. Like Apis is hot and thirstless, bryonia is hot and thirsty. Okay, and bryonia has other symptoms like constipation, and also pain always aggravates, motion aggravates pain. That is a characteristic of bryonia. And next is bufo. Bufo rana, which is made up of toad. It is actually epilepsy before menses. We can think of bufo. All the convulsions. Some of the other remedies which aggravate, that is epilepsy, which is aggravated during menses. Before menses is bufo. Other remedies which we can consider are cuprum, pulsatilla, and these are the remedies. During menses is oinanthe crocata. Convulsions during menses is oinanthe crocata. So these are the remedies which are aggravated. That is, menses aggravates convulsions, epileptic attacks. So we can think of bufo, oinanthe, cuprum, pulsatilla. So these are the remedies. So if we should consider other painful remedies like nux vomica, where pain is the patient is irritable and he's chilly. Nux vomica is chilly, thirsty. And lycopodium, we can think of lycopodium, who is sometimes hot, sometimes chilly. Right-sided remedy, desire for warm drinks. Pain is usually, again, there is lack of confidence, and these are the general symptoms of lycopodium. So these are the main remedies which we can consider. So here I discussed around 10 to 15 remedies which we can think of in dysmenorrhea. And dysmenorrhea is really, I mean to say, it is very practical. And if we know the keynotes of the remedy, the treatment is really the homeopathic treatment helps a lot in relieving dysmenorrhea. And if there is pelvic pathology on the functional level, that also can be attended to. And PCOD can be cured. If dysmenorrhea is because of PCOD, that also can be cured with homeopathic remedies. So this is what I wanted to tell. And the session is open to questions and answers. You, all are well. I'm ready.
Actually, Doctor, I think up to a few more time, you can extend your timing because people are people will. I don't know whether they are ready to ask questions. Let me ask. Otherwise, you can continue for.
Okay. Okay. I'll discuss some more remedies. You ask if they are ready. I can answer questions.
And the participants, yeah, they are ready. Okay. Okay, Dr. Hariharan, please. Please unmute yourself.
Okay. Doctor, what are the pathological conditions which causes dysmenorrhea?
That's what I told.
I mean, see fibroid, actinomycosis, and see different type of fibroids, different type of submucosal, and a lot of type of fibroids. Such fibroids also causes dysmenorrhea.
Yes,
so
sir, definitely.
you please explain the different type of fibroids and which causes dysmenorrhea.
Okay, so basically there are 3 types of fibroids. Sorry, 2 types: submural fibroids and submucosal fibroids. Submural fibroids are they are present in the myometrium, that is a muscle layer of the uterus. Okay, they don't cause much of problem. Of course, during dysmenorrhea is mainly due to vasoconstriction, and also due to lack of as we say, the junctional zone. We say so that subendothelium of the endometrium, that is a junction between the endometrium and the myometrium, it is irregular. Okay, so the when it is irregular, the distribution, the receptors are irregular. So this vasoconstriction and this spasmodic, that is a uterine contraction, irregular dysrhythmia, what we say, dysrhythmic contractions of the uterus will cause pain. That is why there is dysmenorrhea. So the submural fibroids, or which is in the muscular layer, they are quite deep. More than them, these submucosal fibroids, which are below the endometrium, they cause more problem. They cause more of pain, and also they cause more of bleeding, that is menorrhagia and metrorrhagia. There may be continuous bleeding for more than 10 days. There may be intermittent bleeding, that is between periods. So, okay, such things are due to submucosal fibroids. So yeah, of course, they are problematic only. And again, some problems like adenomyosis, endometriosis. Endometriosis is if there is a uterine endometrial tissue in the fallopian tube. See, the epithelium of fallopian tube is totally different from the endometrium. Okay, epithelium of the fallopian tube is ciliary epithelium. It is columnar and secretory. But here, endometrium keeps on changing. It is never constant. Okay, first 15 days it is proliferative, as I told earlier. First 15 days it is proliferative. Next 15 days it grows. That is, it increases in size. So it is never same. It keeps on varying. So endometriosis is endometrial tissue if it is present elsewhere other than the endometrium. That is the innermost layer of the uterus. That is endometriosis. Of course, when there is because this endometriosis, this endometrial tissue is reactive to hormones, estrogen and progesterone. If it is present in the fallopian tube, again, that will also cause bleeding and that will cause spasmodic pain in the hypochondriac region. That also can happen. If it is present in the ovary, again, it will cause problems. Okay, so this is about the pathologies. Even simple PID also can cause pain during menses because of infection. And also, I have to tell you one more thing. During menstruation, infection rate is high. Infection rate is high because estrogen is not there. Under the influence of estrogen, in the vaginal epithelium, there is Dodderlin's bacteria, which causes the conversion of lactic acid, glycogen into lactic acid. This acid causes the vaginal pH to be under 4. And when the pH is acidic, there is no growth of bacteria. Okay, this is under the influence of estrogen. But during menstruation, estrogen is low. So there is all chances of infection during menstruation.
Okay, doctor. That means, doctor, these, I don't know, I have not see the hormonal changes. This progesterone and estrogen level variations may cause dysmenorrhea. I think it's so. Is it correct?
No, sir. Actually, hormonal levels, they change. Definitely, they keep changing. They are never constant. Hormones are never constant. Okay. Dysmenorrhea is caused, as I tell you, dysmenorrhea is caused because of the dysrhythmic contraction of the uterus. See, there are, what do you say? As I told you, endometrium grows. Okay. At the peak, that is at around the ovulation, the endometrium is around 8 mm. Okay. So during menstruation, almost 70 ml of blood is lost. That is what? The mucus, the endometrial tissue, the glands, the cells, debris, everything is lost. That comes up to around 70 ml. See, the uterus wants to throw it out. Okay, it wants to make it clear so that then during the next cycle, there is fresh endometrium which is growing. Okay, so this dysrhythmic contraction causes dysmenorrhea. In primary dysmenorrhea. Secondary dysmenorrhea, there is some pathology, as I told you. There may be mass, there may be cyst, or there may be, as you told, fibroid. There may be infection.
Okay.
Okay, so this is estrogen, progesterone don't have any role in dysmenorrhea. Dysmenorrhea is mainly due to this one. What do you say? Dysrhythmic contraction of the uterus. 2, it is eager to throw out the waste. That is waste only. No, now it got wasted because there is no conception. The endometrium got wasted now. So it wants to throw it away because, and that also it has to be done within 2 or 3 days. Because again, ovulation will happen for the, what do you say? The next ovulation will happen in next 11, 12 days. If you take it from the LMP. So within 2 or 3 days, the whole endometrium have to be shed.
Okay. Doctor, see, low level of hemoglobin may cause dysmenorrhea.
Low level of yes, low level of, good question, sir. Low level of hemoglobin decreases pain threshold. That way, the girl may have dysmenorrhea. She'll not have tolerating capacity.
Okay, that is right.
She'll not have tolerating capacity. That is what we tell. They'll have low level of pain threshold.
Okay.
That
time you must supplement hemoglobin.
Yes. Hmm? And also with food, you can definitely supplement. See, mainly in our country, the main cause of anemia is nutrition, lack of nutrition.
Correct.
Main cause of anemia is lack of nutrition in our country. So if we and also we cannot just simply say it is only because of nutrition. First, we have to correct nutrition. If not possible, give some supplements. Or even then, if the anemia is not getting corrected, we have to do further investigations.
Okay.
Further investigations to check vitamin B12 levels, intrinsic factor, and other erythropoietin. There are so many things. Again. So nutritional anemia is easily corrected with food and supplements. Okay. And more of, as you told, hormonal changes will cause mood swings more than dysmenorrhea. They don't cause mood dysmenorrhea, they cause mood swings. And because of mood swings, girls don't eat properly. That will cause nutritional anemia.
Correct. See, mood swing. That is
Mood
very
swings.
correct.
Mood swings that will cause in teenagers primary dysmenorrhea. That will cause mood swings, and a girl will not eat properly.
Mood swings. That is PMD, premenstrual tension is happening so.
Yes, exactly.
Okay. That condition we can correct it our homeopathic medicine. Wonderfully we can correct.
And
Okay.
also sometimes counseling is also required. See, girls, they usually don't listen to mothers, and they also think this is happening only to them. If we counsel them properly and tell them, see, all girls face the same thing, all human beings have this, and take them into confidence, most of the times only this will work very nicely. You tell them, see, you are not the first one. Everybody, all women would have passed through your stage, and definitely they would have had dysmenorrhea. And many girls like you, even now at your stage also, they may have it. So that confidence alone sometimes will do the work.
Very correct. Doctor, premenarcheal counseling is very, very important, I think.
Both for kids and parents.
It is correct. Very good class, sir, doctor.
Thank you, sir.
Hello, doc, who is I think COVID vaccination. Mute your.
Yeah, greetings. I'm audible.
Yes, sir. Tell me.
Okay, thank you very much. First of all, greetings and namaskaram to all our honorable doctors and members, and special guest to Honorable Dr. DEEPTHI. Very
Thank you, sir.
informative session. Very happy to listen. Honorable Doctor, I have two questions because I have found these two cases which have been not solved. One is that the beta HCG cells are normal before conceiving. And after, as soon as she conceived, the beta HCG cells levels immediately get on 0. And molar pregnancy is there. Repeatedly 9 to 10 molar pregnancies, uterus infection is there. After getting the homeopathic medicines, still the beta HCG level after conceiving, it's not improving. What do you advise the medicine for that lady? And what is the cause you think that is the deficiency of the master gland, the pituitary gland? And second, the menses or the periods are irregular.
Okay.
Sometimes.
So have you got the USG done, sir?
Yeah, ultrasound is normal. There's no endometriosis. Yeah, no PCOS.
Okay.
The ultrasound is normal, but she is still not getting recovery from the beta HCG protection after conceiving. This is main issue.
Sir, and also have you checked her hormonal levels, estrogen, progesterone, FSH, LH, prolactin?
Yeah, LH, FSH, prolactin, and all estrogen, progesterone,
Thyroid.
all hormones. Thyroid, yes, also thyroid is okay.
Androgen, testosterone, you have checked?
Yeah, androgen have been checked. EMH is okay. Estrogen is okay. Prolactin is okay. Every test is okay. I'm just surprised why the beta HCG cells are not.
So basically, beta HCG is human chorionic gonadotropin. Okay, yes. And this human chorionic gonadotropin is secreted after conception from the chorion. In the beginning, it is secreted from the chorion. That is the what we call the antral cells of the embryo, zygote.
Right.
Okay. So there must be some problem with the conception itself. There must be some genetic problem. Have you checked the sperm levels of the husband?
Yeah, it's okay. He is 85%. And I've rechecked twice.
Okay, sir. Does she have any other mental problems? Does she have any other, I mean to say, not psychological. I'm asking about mental problems. Like her IQ is low.
No, IQ is very fast. She is extraordinary sharp. She is extraordinary sharp, and peacefully she decided to move. And there is no, but one thing, there is a numbness and on the face of sometimes on either on the right, sometimes on the left. And second is the loss of memory.
Loss of memory.
Yeah.
Okay. Sir, maybe there is some gene mutation in such a case, because if hormones are normal and everything else is normal, beta HCG is not able, this shows that she's not able to carry a normal child. She's not able to conceive a normal child. The zygote is not able to produce. See, the zygote produces HCG. Okay.
Yes.
It is not
Yes.
her body.
In
Okay.
in
Yeah.
allopathic, she goes for IVF for more 8 to
Okay.
9 times. IFPH
bad.
had been done 9 times, minimum 9 times.
Okay.
Then
Sometimes, yes, sir.
then they want to put them on the chemo drugs, so she refused. She don't want to go for the chemo. She believed because there is nothing. They said we will try, and maybe your beta HCG cell may be going to start produce normal. I don't believe this. And then she just have a U-turn, and then she converted into homeopathic medicines.
Okay.
So,
Sir, have you inquired her past history, sir?
yeah, past history is that she is married since 6 years ago, and since after the first month, because their whole family is very conscious that they should conceive immediately. And
Okay.
but unfortunately, when they bring the reports, I was just shocked that it doesn't looks like 6 years reports. It looks like 15 or 20 years old reports. There's a lot of files, 6 to 7 files, a bundle of files. After every 4 or 3 months they go for IVF, they go for the treatment, hormonal treatment in the allopathic gynecologist doctors. But after 5 in between 5.5 years, they just surrender and they converted to homeopathic medicine. In my clinic, they are since more than 5 months. There are a lot of issues. Okay, the period is normal now. The clotted blood, the purple blood, clotted blood is okay. Dysmenorrhea is okay. Everything is fine, but still the beta HCG is not improving. No, in normal, without conceiving, it's okay. But as soon she conceived, it doesn't respond.
Okay, sir. Have you checked for her past history in the childhood? I'm saying, did she have any like any infection? So see, sometimes these infections like mumps and measles, they can cause problem in the ovaries. We have seen
Yes.
mumps oophorytis, complications, sequel of mumps. Mumps oophorytis, mumps and measles, after measles, if it is not treated properly or if it is left untreated or
Right.
if it is suppressed,
Yes.
if they see the eruption should come out totally.
Yep. Very
If
right.
they if they have not allowed the eruption to come out
Yes.
with suppressive treatment, it may directly affect the ovaries.
Exactly. I agree.
Have you done torch tests, sir? Torch.
No,
There are 5 infections for
right.
torch. That is usually done during pregnancy. But if there is problem with conception, then also it is done before pregnancy. Okay. So you ask her about chronic infection, sir.
Okay, very right.
And no, sorry, childhood infection. And in such cases, you can think of some these nosodes. Try giving her some nosode.
Okay.
And also family history is very important. Family history, if there is cancer, diabetes, strong history of cancer, strong history of diabetes in the family, consanguineous marriage.
Diabetes is there, and late conceiving is there always in the another sector. And she is fourth children is in her family.
Okay.
But
no, sir, you inquire about her childhood. I think there must be some suppressive fever.
Okay.
That is what is causing problem. See, sometimes these are very, very minute, subtle problems, sir. They would have not taken into account at all. They would have missed it. Hey, it's gone. That's all. I mean to say they would have not thought of it at all. This would cause the problem.
Very right. Right.
So you take her childhood history, sir, and history of vaccination. Sometimes unusual vaccinations. Even COVID vaccine is causing problem.
Yeah, no, she doesn't go for COVID. I'm very happy because a lot of my patients, I am also against her. This is why also COVID vaccine is Third World War. I believe this, but second thing, Honorable Doctor, the endometriosis. Can you let me know what is the best medicine for endometriosis or PCOS, please?
I had discussed PCOS last session, sir. PCOS has been discussed. Endometriosis, as I told you, endometriosis, if it's functional, if it is within the uterus, it can definitely be controlled. If it is extra uterine, that requires surgery.
Okay.
If it is within the uterus, if it is within the fallopian tube, or if it is in the uterus, sometimes it is in the myometrium. All these can be controlled. But if it is out of uterus, it is very rare, very rare actually. But that requires surgery and removal of the endometrial tissue.
Right. Honorable Doctor, billions of thanks. You have a lot of knowledge. Please share your contact number on the panel because I am weak in the gynecology.
Nobody is weak. Nobody is weak. Nobody is strong. It is all experience and study. That's all. Nothing else. Nobody is weak. Nobody is strong. I don't believe it, sir. And
Really,
you don't say I have a lot of knowledge. It is not even a drop in the ocean.
Right, Honorable Doctor. It's really great. I appreciated your knowledge, and I wish I have to pray a lot for you for your skills, and the people get and the doctors get the benefit. My word of thanks is not enough for you. Yes, I appreciate it. God bless you a lot for this.
Thank you, sir. Sir, but actually, please check her childhood history and family history. Any unusual vaccination, in such cases, you can definitely think of some no-sode. It will definitely help.
I am because if there's a history of mumps or another suppression, so let me have to come on constitutional medicine and nosodes. Definitely it will work.
Definitely it will help. Because yes, sir, because there will be sometimes there will be a block. And also, sir, you also inquire history of dog bite.
Right, dog bite.
History,
There's no dog.
Rabies vaccination. Rabies vaccination also will cause block. And also, sir, I also have to tell you, I've seen patients who have been taken chloroquine for malaria. See, in rural area, what happens is they are very eager to give malarial drugs, anti-malarial drugs. And these anti-malarial drugs also will cause a layer.
Oh, there is a possibility.
Yes. And very good remedies for these are this one. What is it? Chininum ars, chininum sulf.
Chininum ars, yes, very great medicine for liver cells.
Yes.
Special kind of weakness.
Yes. Anti-malarial when chloroquines are abused.
Yes. Abuse. Excessive use.
Yes, sir.
Appreciate it, madam. Appreciate it. Really appreciate it. God bless you a lot. God bless you.
Thank you, sir. Thank you. Hope you got answers for your questions.
I am very happy. Please leave your contact either email or WhatsApp, please. I'm thankful to you. Please, Dr. Ajni, kindly, it's a request to you also. Okay, please. Thank you, Honorable Doctor. Please, billions of thanks and God bless.
Thank you, sir.
God bless.
Thank you, sir.
Bye. Take care. Bye.
Okay. Any more participants to ask question to Dr. Deepthi Anand?
Can I ask one question?
Yes, you can ask.
Okay, doctor, it is out of the question that I have a patient of vaginosile.
Vaginosile.
What is the cause for that?
Sir, what is the patient is she goes for she has some occupation, that is she does some job.
She is a housewife. There is housewife, and she feels that some bulging is there and examined by gynecologist, and they told that it is very impossible to cure by medicine, but she came to me and I referred by in contrapatry, I find the rubric for that. The similar rubric, and I gave her the sepia, and she got relief also. But I don't know about the pathology of the vaginosile. That is
the vaginosile is basically it's same like hemorrhoids in the rectum. Vaginosile is the varicose veins in the vagina. Okay, it's like hydrocele.
Okay.
You know hydrocele, no? It is varicosity of the varicosities in the scrotum. This one is hydrocele. Same way vaginosele is varicosities in the vagina. That maybe she had. Did she have? She has kids.
Yes, 2 kids.
Normal delivery.
Normal delivery.
Sometimes even that may cause. And if she does not do a lot of physical activity, she's always sitting. That is why I asked. Sometimes we tell varicose veins are due to standing. Teachers usually have it. Lecturers, teachers, they usually have varicose veins. The same way, if she has what do you say? Venous patency. Problem with the venous patency in the vagina. That is very rare actually. You've got
Very
a case,
rare.
you are lucky.
Rare.
It is very rare.
See, in 45 years, I met
That is
only
what-
one case. Met only one case, and it is cured by sepia. See,
Definitely.
sepia tenum, I gave
Yes. Yes.
uh,
Other
it-
remedies we can think of are hemamelis,
Hemamelis. Hemamelis.
aesculus.
Only I gave the sepia, see,
Yes.
and she got relief. See, so for 6 months. Now, no complaint. I'm
Yes,
waiting
very
for
good,
any
sir.
further complaint.
Yes, sir.
Okay,
Hope
doctor.
I answered your questions.
Okay, thank you very much.
Okay. Sir.
Thank you, Dr. Deepthi Anand. I think no, anyone not raised hand. You, Dr. Ahmad Hassan, you can ask, sir. Dr. Ahmad Hassan, unmute yourself and ask question. What happened, sir?
Yes. Good evening to everybody. Respected madam, very useful.
Good evening, sir.
Because I can share my only laboratory interpretation that
Yes, sir.
that beta HCG generally
Yes, sir.
people called pregnancy test
Yes, sir.
normally, but it is not like this due to some trophoblastic problem. It can be positive in a 4-year girl, and also it can be positive in 100-year-old lady. So this is due to the hormones. So better don't call it as a pregnancy test. This happens to me once. I have not seen the age of patient, and this doctor written pregnancy test, and I have done it. It came positive, and the age of girl was only 5 years. So due to some problem, it will come positive in male and female also. Thank you very much.
So that is because of the ovarian tumors. Even in
Yes.
ovarian carcinoma, carcinoma of the ovary also can cause the increased levels of beta HCG. Of course, definitely in young girls, that is the main. If you detect beta HCG in young girls, that is it is carcinoma unless proved otherwise.
Yes. Thank you very
Yes,
much.
sir. Okay, sir.
Thank you, Dr. Ahmad Hassan.
Doctor, see how much length we can, the size of the uterus, at which size we can cure by this medicine, doctor, in your experience.
Sorry, sir. I didn't get the question properly. I didn't understand.
The size of fibroid.
Fibroid. Okay. Size of fibroid, what can how it can be cured? Okay. Sir, any size, if it see, sir, means basically, according to me, fibroids are caused in women. Usually you have not conceived. Okay. These fibroids, fibroadenoma, breast, all are of same tendency. They are very much, what do you say, receptive to estrogen. Okay. Pregnancy will cause more of progesterone because whole of during pregnancy after conception, estrogen is very less, progesterone is too much. Because that is estrogen progesterone ratio will be very different. That is progesterone will be very high for maintenance of pregnancy, for all other changes. Progesterone is very much important. And this progesterone receptors, they have stayed there for a long time during pregnancy. Okay. So usually this is because of continuous estrogen without conception, these tumors, fibroadenoma and also fibroid uterus, are very much reactive to estrogen, and that is why it is usually seen in non-parous women or non-unmarried women. Okay. So any size can be cured. Patients should have patience. And also, I also tell you some practical points, sir. If the lady is in the age of conception, say for example, she's got married late, 35 plus, she has got married. Okay. 35 plus, she has got married and she has fibroid due to which she is not able to conceive. We cannot ask her to wait. Practical.
Correct.
Yes, sir. 45 plus, she has completed a family. No, it is not a hard and fast rule that only unmarried women should have fibroid. Even married who have had children also can have, but incidence is more in unmarried women. Okay, so 45 plus, she's not having much of trouble with fibroid. Definitely you can ask her to wait. You can say, why do, see, and 45 plus, usually the line of treatment also is different. In women who have not had children, they will do only fibroidectomy. They'll take off only the fibroid. But 45 plus, if they have fibroid, they'll take off all the uterus, if the family is complete. Okay, so surgery, hysterectomy can cause problems like osteoporosis, early natural menopause, whatever problems it will cause. Hysterectomy will cause more the, what do you say, the intensity of problem will be more. So we can prevent that. We can ask that lady, 45 years, you wait. Definitely it will reduce. It depends on the patient. Definitely it will reduce. You wait. We can make them wait.
Good.
So this is the practicality. See, we should always know our scope and limitation.
Thank you, Dr. Hariharan. Now, Dr. P. Shaila.
Good evening, ma'am.
Good evening, madam. And my doubt is that the gas accumulation and the lack of exercise involved in uterine contraction.
Yes, exactly. Yes, I very much agree with you, because girls who regularly exercise, who do running or yoga, these things, they'll have less intensity. Dysmenorrhea will be less intense. Definitely, because the pain threshold will increase. The pelvic muscles are strong enough. Okay, all these things will matter.
Madam, gas accumulation also involved in uterine contraction.
To some extent, madam. That is what these points we can consider in prescribing homeopathic remedies. See, bloating, better by flatus, dysmenorrhea, better by flatus. All these, lycopodium is a very good remedy.
Okay, thank you, madam.
Thank you, ma'am.
Thank you, Dr. Shaila. And I have one doubt. The clothes during menstruation, it should be considered or not considered? Is it normal?
See, ma'am, clots during menstruation, it has many dimensions for it. See, normally there are not very big clots. Okay, there are very small clots, which are what do you say? And there is not special pain during passage of clots. Okay, this is normal. See, sometimes there is no bleeding only, there are only clots. That is abnormal. And all these points have what do you say? Speciality only in homeopathy. We say, see, there is coagulation, passive coagulation before flow itself. These points you can consider while prescribing. Like there are so many remedies like crocus, where the menses is like pitch. What do we say? They put it before putting tar on the road. It is so dark. It is so clotted. It is like a pitch. So this is pathology, actually functional level only. See, this one come into account for homeopathic prescription. They are very good remedies like sabina for clots, sabina, crocus, lachesis, amamelis, painless passing of clots, and clot size matters. Clot color matters. Where small clots, 3 or 4 clots per menses is normal.
So if it is heavy clot, what are the pathology we have to consider? I mean,
usually clots are seen in PCOD, no? Because as I told, no, there is irregular menses, there is prolonged, there is a cycle is for 45 days. The endometrial thickening is also more. So clots are more observed in PCOD.
Dr. Danesh has raised her his hand. So please.
Good evening, madam.
Good,
It's a very,
good evening,
very,
sir.
very nice presentation once again. And
Thank you, sir.
you really covered all part of these female genital problems. That is something great as far as homeopathy. Your question answer session last some 2 days back was excellent. And today you really showed how beautifully homeopathy medicines will work in fibroids. Definitely, I have cured some of the fibroid cases with even 10 centimeter size fibroid also getting reduced, and even there is no more complaint, just like the patient is happy. So this is the beauty of homeopathy. I would like to say some points today because today at Kerala we are celebrating, our government department is celebrating the 50th year of inception. And along with they produce a video on infertility. The project is named as Janani, which is being produced in Hindi, and everybody can watch and share it, because this is one of the best production as far as homeopathy is concerned, because we have a lot of things to do with almost all areas, whether it is geriatrics, pediatrics, or the neurological case, or whatever may be, but giving a relevance, more importance to the female genital system and the infertility. That is something added to homeopathy, because almost all cases where patients are spending a lot of money but not getting the proper result, and some are even being cheated by those people for the price of money. But here in homeopathy, when a patient, all these cases were successful without even paying a single rupee. Only 10 rupee is the registration fee as far as the government dispensary is concerned. I think that is the only expense they have to pay when they buy a case sheet, only for that. But still, the results are fantastic. Those people, those patients are getting their child even after 18 years, 20 years, like that. When almost all systems say to them that there's nothing to do, we have nothing to do with this your case, like that. So you will have to take a child from some other part of the world by adopting a child, like that. But in those cases, we are able to deliver such results, and our department is very much in working very hard to bring such cases into public, and the project is named as Janani. So please watch all those things, and you can also, everybody can watch this in Kerala Ice Mission. When you click at the YouTube, you can get it, and you can share it, and you can like it, and just like because it is the big promotion for homeopathy. Anyway, we hope we can also present some more cases in the coming days. Thank you, madam.
Thank you, sir.
Thank you, Dr. Danish.
Hello.
Dr. Boblim is there. If you can ask him, he will say what of thanks. And
okay, call him. Actually, I would like to ask you that can you share the video of Janani project? How long it is?
it's just, but today there is no way. It will take time.
Okay, no problem, doctor. No problem. I'm inviting Dr. Bob Lim for saying out of thanks to Dr. DEEPTHI.
Oh, thank you very much for inviting me to give a word of thanks on behalf of IFPH, International Forum for Promoting Homeopathy. I would like to express my sincere thanks and appreciation to our doctor lecturer today.
Thank you, sir.
I hope that she's Dr. DEEPTHI. She's very famous in gynecology, and I hope that she will continue continue to share her experience with us, and she has vast experience in this field. And today, most of us learned a lot from her.
Thank you, sir.
And then, since I'm closing, I wish to say once again, our grateful thanks to Dr. Deepthi. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you so much. And thank you, Dr. Deepthi Anand, for your presentation and question answers. Really,
Thank you,
it was wonderful because everyone cleared their doubts. And one more request. Thank you, madam.
Thank you.
One more request to the participants. Please place your name with your ID, name and photos, because it is very difficult to us to identify who you are. Most of the participants are showing their mobile names. So from the mobile, we cannot identify you who you are. So please place your name. If you please place your photos also. I think many of before even I don't know how to place the photos. If you don't know how to place the photos, please take help. Otherwise, we will show it once. Okay, that will be very easy for us to. Dr. Manish, what do you want to say?
There is an announcement for tomorrow. We will have a session from Dr. Shubhajit Banerjee, Calm for Allergy. He is a person having very high knowledge, and he has completed MD in homeopathy, and he is having lot of higher studies at USA. So that will be also a big session for tomorrow.
So everyone please join. And one more thing I wanted to tell you, we have a YouTube channel, Instagram page. So please subscribe our channel, and you can, if you miss the classes, you can watch through our YouTube channel. And we have many participants for the Zoom session, but we don't have much subscribers in our YouTube channel. So IFPH, you can type IFPH in the YouTube. You can select our channel and you can subscribe. That will be more useful for you and for IFPH also. If you miss the class, it is very easy for you to follow the classes. So thank you so much. Now it is the time for the Malayalam session, and I am inviting Dr. Danesh to moderate Malayalam session. Who is moderating?
Dr. Shaila.
Dr. Shaila, sorry. Dr. Shaila for moderating Malayalam session. Dr. Shaila, please welcome. Dr. Shaila, you are not audible.
There is some problem. Are you?
Madam, can you join again?